in there. The governor's this tall, Chris is about this tall. Security detail says he's on his way, so at least a minute, if not less. Give the president another 60 seconds, so 1 minute.
All ready? Thank you. As you know, this is a very fast-moving and fluid situation. 4 days ago, we had 162 presumed coronavirus tests. Today we have 568. So it's gone from 162 4 days ago to 568 today. It went from 21 deaths 4 days ago to 37 today. It is spread from 9 counties now to 15 today. We now have COVID-19 cases in the counties that represent fully 75% of the population of the state of Washington. It is unfortunate, but it is true that this virus is going to spread to other counties, and it is spreading very rapidly. We have concluded that a county-by-county approach to this epidemic is not sufficient. We need to get ahead of this wave, and we need to do it today. I believe consistency across the state has many advantages in our policies in this very dynamic situation that we're all managing. Second, we need a more coordinated state approach to this problem, given how integrated our state is in transportation, economically, and in our culture. Therefore, I'll be signing several executive orders this afternoon. Today, my first order will close all K through 12 public and private schools in every district across the state of Washington. Schools will close from 12:01 a.m. Tuesday, March 17th through 12 p.m. Friday, April 24th. The timing will coincide with spring break for most Washington state school districts. Under this order, schools must close and end classes by the end of this next Monday. The first possible weekday back would be April 27th. Just as with King, Snohomish, and Pierce counties, there are critical services that our schools provide that will need to continue during this closure period. That includes nutrition and child care. This needs to be addressed throughout the state of Washington. I'm urging labor and management to work together in the best interests of our kids. This is not a vacation. Work may look different, but the expectation is that school employees will still be working. ESDs throughout Washington have been communicating with our superintendents across the state, and we're hearing that there is broad support for this position. Second, we are also going to restrict activity at all statewide public and private universities, colleges, community colleges, and technical schools, and private career schools, and apprenticeships. The restriction will essentially say that there will not be in-person education happening on their campuses. The same dates we are using for the K through 12 school closure will also apply to the higher education closures as well. Although I don't think actually we should call them closures when it comes to colleges, because they will be able to continue robust online learning in many cases. Labs and clinics may continue if social distancing 6 feet is imposed and a person is designated by the college or institution to ensure implementation of social distancing. We also will permit continued core functions, including administration, safety, continued use of dorms, food service, research, and medical clinics. Third, on Wednesday, I announced a ban on events of 250 or larger in King, Snohomish, and Pierce counties. Today, I'm expanding that order across the entire state of Washington. As you know, the events that are prohibited are gatherings for social, spiritual, and recreational activities, including but not limited to community, civic, public, leisure, faith-based, or sporting events, parades, concerts, festivals, conventions, fundraisers, and similar activities. Fourth, on Tuesday, I put restrictions on visitors and protocols to nursing homes and assisted living facilities. I'm expanding this to include adult family homes. Long-term care workers, particularly those taking necessary classes and testing right now, are also facing disruptions as a result of the virus. Long-term care workers are required to complete training. However, I intend to waive specific statutes requiring strict compliance with training testing dates through April 9th. Later this afternoon, the Department of Labor and Industries will be issuing a hazard alert regarding the COVID-19 virus. We think this will help our businesses succeed in maintaining social distance and good, safe workplaces for workers across the state of Washington. I want to reiterate that I don't take these decisions lightly. We're doing this for the health of all Washingtonians, and I'll turn this over to Chris.
Thank you, Governor Inslee. Chris Rakedale, Superintendent of Public Instruction. We've had a lot of conversations with superintendents and our educational service district leaders over the last 24 hours. And while there are still regions of our state that have not had a documented case, the concern of parents grows, as we have indicated earlier. The absentee rates grow. The number of our substitute teachers and bus drivers continues to cause disruptions in the ability to deliver school in a lot of these parts of our state consistently and equitably. For this reason, we support the governor and have encouraged this statewide consistency. This gives our state the ability now to operate as one entire unit in our approach to K-12 schools and our partnerships in higher education. As the governor indicated, there's some pretty essential services that we're going to challenge our districts to be a part of. I'm going to reiterate what I said yesterday in part. This is a moment for our organized labor partners and our superintendents and school boards to have a relentless commitment to the shared sacrifice of Washingtonians. We have to provide these essential supports to each other in our districts, to our kids and their families. The work will be different. There's going to be expectations that don't look like a traditional school day, but our commitment to vulnerable populations, food and nutrition, and getting our seniors and juniors the credits they need to transition will continue to be the initial work that we do. Our districts are showing remarkable progress already in building out a comprehensive food network for our students. We have the flexibility we need now to do that work in every single district. There are no food shortage issues. We're going to use bus drivers, for example, to deliver food. We're going to use para-educators and some teachers to make sure that our most vulnerable kids get supports. We're doing one-on-ones already with seniors to make sure that the continuity of their learning continues. Our work is moving forward. It just looks differently. To the matter of distance education, a lot of questions have come about that. Again, the governor has been really encouraging of districts to be creative about this process, and this permits that. Our districts are grappling with some federal regulations, and we're going to push through that, I think, in the next 24 hours in guidance to our districts. We want them to be creative. We want them to be innovative. This is an opportunity for all of them. I want to reiterate, though, they are focused on equitable services, and I think they can deliver on that, but they're going to take the time necessary to do that well. And I will reiterate that over this next week, while they can be engaged right away, we would expect them to need some time between labor and management to build these new supports and these different services and these sort of reformed efforts that they're going to have to do over the next 6 weeks. So I ask for patience of families who I know are scrambling for child care. They're going to need to be patient for another week, and then our systems will be pretty well deployed and ready to go in each community.
Thank you, Chris. I think Chris did a remarkable job trying to coordinate our communication with our educational leaders, and it's actually been very comforting to know that educational leaders think action is required. Stand for questions.
Governor, is there any consideration at this time for limiting non-essential travel out of people's homes, either statewide or in some of the harder hit areas?
Not at the moment. So we do not have active consideration of those issues. But obviously, this is a very fluid situation, and we will make the best decisions going forward as we can.
Governor, we've been asking the federal government to declare a state of emergency. President Trump has just done so. What is your response to that? What does that mean to our state? Who might that help?
Yeah, I talked to the Vice President about this yesterday and asked him to urge the President to make such a declaration. And that is helpful to the state of Washington because it will make some Medicare and Medicaid benefits eligible where they would not be eligible. It helps with the public messaging as well to let all Americans know how serious this challenge is. So it has been helpful, and I thank the Vice President for his help in this regard. I also had some discussions yesterday with him about the possibility of Washington State helping expedite some of the laboratory testing protocols that have been challenging, and a couple other issues. So we're glad that the federal government has helped in this regard.
Governor, how many monitors does it help them as well?
I'll come back, yes. Sir.
on the school workers.
Yeah.
You mentioned yesterday that the state of emergency might help them. How might it help them?
Well, it helps them possibly, and this is only a possibility at the moment, with coverage of unemployment insurance. The type of declaration the president made today probably will not be able to help in that nature of that specific requirement. But I'll tell you how it will help, and I'm glad this happened today, is to really add motivation of Americans to help us in this effort. And I'm really serious about this. You know, Chris and I and school directors and legislators, we're doing some positive things together. I talked to Republican leaders today. I really appreciate their leadership in the legislature getting the funding package through of $200 million. But the people who really count here are just, you know, John and Joe Smith, the citizens. I'll give you an example. What's really going to be the most effective thing here are people making individual decisions to do social distancing and keep this virus from overtaking the state of Washington. Small example, if we have to go into meetings, here's a small thing. Let's make sure that we have an empty chair next to us when we go into meetings so that we've got at least 6 feet apart. That strategy could be as important as any presidential declaration. And I say that really urging people to join this cause. I'm pleased that many are. I'm pleased that some of our older Washingtonians and those with health care are staying home and keeping themselves out of harm's way. We're seeing a lot of great things happening by private citizens, and we want to continue to encourage them.
Governor, how will you be monitoring food distribution in the school districts, and if and how will you deploy the National Guard to facilitate that?
Well, I'm going to let Chris handle that.
Thank you, Governor. We've got an expectation of our districts that they're going to use their existing benefits that they get. There's both state supports and federal supports. Again, that food supply is secure. Our warehouses are ready to go. Most districts are going to create multiple checkpoints in their community where families can come and get breakfast or lunch. Some of them are already working on distribution models where they're going to deliver and bring that. Our reporting system will be on several factors that the governor has asked us to report on: nutritional services, child care for healthcare workers and first responders, our seniors and juniors progress. All of these will go as an expectation that districts write plans about those, and by the end of next week we will be collecting those plans to know what the game plan is in each of the 295 school districts.
And so those plans will also include the coordination for child care for families?
They will, and again, this is one where a lot of them have very sophisticated systems already. They're already an ECAP provider, they're already a before or after school program provider, and it's a matter of sort of filling in the gaps. We do have districts who don't do any of this stuff right now, and so for them it's a harder launch, it's a harder start, and you might see them partnering with the nonprofit community or the private sector where there are capacity opportunities, and just simply utilizing them in partnership.
And do you have concerns? I mean, obviously you're closing the schools to limit the spread of the disease, but you're going to be having child care. Do you have concerns about still the disease spreading through that? And are there any sorts of preventative measures or consideration to be given in that realm?
This is a balancing act between making sure that we take the right health stance, and I think the Secretary and the Governor have really led on making sure that this state is going to be ahead of the curve in these large contemplations, the social distancing. We're going to reduce the spread of this. But there's a reality, too, about our society, and that is that every parent cannot simply say, I'm not going to work anymore and I'm going to go be with my child. We want to provide an opportunity for those workers to be on the front lines doing their job, saving a restaurant because that worker can be there to be on the job. That's a responsibility we have. We still expect school districts to follow protocols about social distancing, though. So I only mention as an example, we've heard from Spokane this morning who says we have a plan in every building to provide child care, but it's not going to be every kid back. It's going to be some limitations to that. There's going to be distancing protocols to that. We have 1.2 million students in the state of Washington between the public and private schools. We're not talking about all those students coming back. Your high school students, most of your middle schoolers are probably going to be at home, learning at a distance, or working on some sort of learning strategy. We're talking about a subset of elementary school students primarily, and some 3- and 4-year-olds who still need support because mom and dad or grandparents can't quite figure out that local child care option.
Can I add something to that, Chris? As far as child care, I really believe that we need to get in the mode of World War II thinking of pulling together. You know, they had rubber and tin drives where citizens helped the war effort in World War II. And to some degree, we got to think about this child care issue, because we can't simply turn the schools just into child care centers, because the whole effort here is to reduce the transmission of disease. So we are really asking people to think of the schools as the child care center of last resort, and we want to make sure the priority of that is given for the families of healthcare workers, because we simply cannot have nurses leaving hospitals when they become deluged with patients to do child care, and same thing for first responders. So families, we're asking them to look for alternatives other than schools to make sure that these folks and those in poverty, frankly, who really need it. We hope that that's the case. Somebody asked me about the National Guard. The National Guard will be available at the moment that there are requests for things that they can actually do to be helpful. That may be involved in some of the nutritional issues. It may be in some security issues. At the moment, those requests have not come in, except the Guard is now involved in the logistical issue at our Emergency Operations Center. They are on the job.
Governor, could you address the issue on the National Guard? There are rumors out there right now that the entire state's going to be under quarantine in the next 48 hours. The National Guard is poised, ready to put a perimeter around the state. Restaurants are going to be ordered closed. Can you address that and dispel rumor or ease some fears out there?
There are no known proposals or even consideration by any level of government that I'm aware of in this regard. We do have to guard against both viruses and rumors in this situation. And so I can assure you that I have not heard anyone propose that or even consider it at any level of government that I am aware of. So I know you're going to help us dispel rumors in this regard.
Governor, in Kent, there's a situation at a quarantine site there at a hotel where someone who was supposed to be quarantined apparently walked away. Is that a kind of example where maybe we need to get the National Guard if we have more quarantine sites with more positive tests coming in?
It could be. We have, as I've said, we haven't had a request for that type of service from the Guard yet, but we would certainly consider that, and the Guard might be able to provide that kind of security. I will say that we have witnessed a remarkable degree of compliance with voluntary decisions to stay in isolation. The person you're talking about, I don't know if they were under a legal restriction or just a self-imposed. I don't know the answer to that. But yes, the Guard will be there when we ask them to be there, and we know how talented they are.
Up until that point, Governor, are you doing anything to make sure there aren't more walkaways from quarantine sites, because it obviously has the nearby communities nervous when that happens?
Well, obviously, if there are legal quarantines, that means a legal decision that a person cannot go out in public. I'm not even sure there actually are legal quarantines at the moment. I think the vast majority have been requests, and the vast majority of people have complied without any legal prohibition. But yes, obviously, if there's a legal prohibition, we'll exercise all due efforts to make sure they follow that legal rule. And the Guard could be helpful. As I said, when they're asked, they can be there.
The Vice President talked a little bit about last hour setting up drive-through testing centers and store parking lots. It would seem likely we would be the first to have that.
I'm sorry?
It seems likely our state would be the first to have that, since we have the most.
Well, we have to some degree. The University of Washington essentially has I don't know if you technically call it drive-through, but it's a focus center that's very convenient for the University of Washington community. I think in Everett, I've heard that there's some consideration of setting up such a system. I want to mention this testing issue because I know people are concerned about it. I got a report yesterday that looked like the turnaround time for tests that when samples are taken are anywhere from a day to 48 hours. So in Washington, we've appear to have a pretty good system to get tests done in a timely fashion, up and running. We know that has not been the case in other places in the nation. It's one of the reasons I talked to the Vice President yesterday. We're thinking about possibly being able to allow our labs to help the federal government in their responsibility to certify labs so that they can start really doing huge throughput. So we're examining the possibility of that right now. Anything else? Yeah.
I was talking to the House Minority Leader, J.T. Wilcox, this morning. He said he supported your decision yesterday on Kingston, Homish, and Pierce counties, but he said he had some concern about extending this ban across the state because of the economic disruption that it would cause and sort of the personal chaos of people's lives. And then that might be a very heavy cost in places that haven't even had any cases yet. What would your response be to that?
I talked to JT this morning about this issue, and I've appreciated his attitude towards this, and Senator Schussler of the Senate, both. They've been helpful in allowing us to consider these issues. What I would say is that those questions are very, very legitimate. Look, to be concerned about economic impact of these closures, to be concerned about the family's disruption with child care needs, to be concerned about whether for sure we're going to be able to do the nutritional needs, these are really legitimate concerns. So I would say these are really important questions. And we've asked all of those questions in depth. And I believe we have come up with something that my health department has said clearly we have a clear and present danger of rather epic proportions in the state of Washington. I'm not sure we've ever faced this since the 1918 Spanish flu. And clearly there is a good reason, many reasons to believe that reducing the contacts of children in a school can reduce the transmission rate, and really good reasons to believe that to make it effective, you've got to be ahead of the whole peak of the epidemic. And really, and also clear that we have educational communities that have shown great creativity in solving these problems. So you put all those things together, and we've decided in a very difficult judgment call that this is in the best interest of all Washingtonians to take this. But I want to say I appreciate a lot of the Republican legislators who acted with great dispatch to pass this $200 million appropriation. And I asked JT that any concerns as this develops he has to give me a call, because there's things we can do to help local communities get through this. So far I think that's a good working relationship. You'll have to ask him specifically about his thoughts today.
Governor, there's been a report now, the Department of Correction employee up in Monroe tested positive. Are steps being taken to remove or transfer inmates to other facilities, lock down the prison? What's the response?
Yeah, I just was briefed about 2 hours ago by our DOC personnel, and I think they're doing some really strong measures. They're doing screening of employees as they come to work. They're trying to get some extra thermometers now to make that more effective. They have good isolation, I believe, strategies to isolate people who are either positive or have contacts. And I've been assured that those things are in place. We talked about some questions about whether we might want to curtail some of the work release issues that are going on when people leave a prison to go out into the community and then come back. There may be some sense in curtailing those right now to some degree, at least those who aren't doing essential services for the state. So that's going to be something under consideration. So I feel that there's good protocols in question. But look, we got to understand this is a devilish virus. And when you have people who can go into an institution and infect people when they have no idea that they have symptoms, and we have hundreds of people going to work in these institutions, this is a tough nut to crack. And that's one of the reasons we have felt we should be proactive in making this a statewide closure of schools and making it a statewide reduction of these large gatherings. These are the most powerful things we can do against a very dangerous virus.
Quick question about the North Shore School District. Does your order require them to end their online learning that they were doing?
No, that's a very important point. And talking to the superintendent, it seems like they've had considerable success of that. So no, this would essentially allow schools to do online learning, to do different ways of traditionally having remote learning, and they've done that in many cases during Christmas break and spring break and snow outages. So no, it will allow, and we'd certainly encourage districts to do, what they can do on remote learning. Now, the difficulty of thinking about this, though, is districts are very disparate. They have different populations. Their kids have different technology at home. So, there's going to be probably some different decisions made on being able to use those systems. We have to accept that. But I believe that what I've heard, SUPs and principals are going to be as creative as possible in this regard. Chris, do you want to add anything to that or not? Yeah.
Yeah, thank you, Governor. I appreciate that. they've described that as a temporary pause, and it's because they're really committed to the work, but they have also learned a lot in the initial days of that. The technology I don't think is a big barrier, but they are very serious at North Shore and elsewhere about this question of equitable access, and we're still working with our partners in the federal government to make sure that their regulations on us about this work, particularly students with disabilities and some other populations, can be met, and we're really partnering now with the superintendent there, and we're together on this. We want them to keep doing this kind of thing, but we also want them to do it equitably, and they're committed to that. Can I just say before my part wraps up, we've been working a lot of hours together, and the whole state is grappling with this, and we've said before, this is a moment like none other, a moment of perhaps once a century. But for 45 minutes of my life yesterday, I forced myself away from the office to watch a 13-year-old girl play volleyball. And it'll be her last volleyball game of her middle school years. And I say it because in this moment, kids feel a little robbed. And we're into the data, and we're into the science, and we're into the economic impacts, but I would challenge you once more to not be Democrats today or Republicans, or East Side or West Side, or rural or urban, or tech able or not. We're Washingtonians today. And our communities need us to be extraordinarily outside of our boundaries. And that little girl laughed, and her team learned, and some amazing women who coached them were developing young people. And we're getting back to that day. We're going to get back to that day, but right now, we have to put away some of the framework we have about what we ought to be doing and what we should have been doing and where we're going to what can we do together. And I'm looking forward to the day when we get past this as a state and we learn a lot from it, and kids are kids in school again, and that contact that they have with teachers matters. This online learning protocol is an opportunity for us. It is not the default model necessarily in a crisis, and it is not the default model when we get to normal times again. Schools matter, not just for the content, but how kids interact and how they relate in the social emotional learning. And for 45 minutes yesterday, life was normal. And I'm really confident in Washington State we're going to get back there again. But for right now, let's be the ultra human beings we can in shared sacrifice together to get over the hurdle together. And I know the state of Washington will lead the nation in that way.
Thank you. Thank you. Be safe. Wash your hands.
Keep 6 feet apart.